Ken, thank you. Changes made to the auto no-fault system in Michigan in 2019 are starting to have an impact on home health and other care for long-term patients covered under that plan. That's according to some lawmakers and caregivers. Political reporter Rick Elbert is here with what they say is wrong with the changes. Rick?
Yeah, Emily, reforming auto no-fault in Michigan was talked about for decades, and then almost against odds, a Democratic governor and Republican legislature agreed for a plan to do just that in 2019. Now, those involved with long-term care for people covered by the insurance plans say the consequences are having a devastating impact on those who need that care. It was the Detroit Regional Chamber's Mackinac Conference, May 30th, 2019. Governor Whitmer, surrounded by lawmakers, signs auto no-fault reform, promising to bring choice and lower rates to Michigan drivers. As a result, the association that represents auto insurance companies says people are paying less for coverage overall. Still, Michigan has some of the highest rates in the country. Fast forward to January 12, 2022. People who depend on those policies for long-term care, their families and caregivers converged on the state capitol in Lansing to urge lawmakers to reinstate funding that was cut by 45% for some services under auto no-fault reform last July.
People are losing care, people are dying, and there's going to be a mass discharge of clients who are already overrun hospital system.
That was the grim prediction from Brandon Monroe of First Light Home Care the day of the Capitol rally. Some companies that provide home care and other services have already closed or quit servicing clients covered by no-fault. Margaret Cruzy, Executive Vice President at Hope Network Neurorehabilitation, says that reduction of reimbursement that kicked in last July was a concern when the bill was signed.
This was one of the big areas of concern for providers and some legislators. Everyone knew that that might not work, but somehow we don't have a solution yet.
We were told that, yes, this is not the in-all, end-all bill. There will be some follow-up bills to make some changes.
Representative Phil Green, a Republican from Milliken, says the idea was that auto no-fault reform would be followed up with some fine-tuning, but
now we're 3 years out.
And those changes haven't come. So Green has introduced his own bill, HB 5698, that he says would bring the reimbursement for services like home care, in-home skilled nursing, transportation, family attendant care, and case management back to the levels prior to the cuts implemented last year. But that does not sit well with the insurance industry. In a release from the Insurance Alliance of Michigan, a trade association that represents auto insurers and others, Executive Director Aaron McDonough was quoted as saying, "Representative Green has portrayed this bill as a simple fix that would add no additional cost to the system, but that couldn't be further from the truth. More than 7 million drivers are seeing savings coming their way, anticipating $400 checks in the spring, and this bill would force auto insurers and the MCAA to reevaluate and likely increase their rates," end quote. When I spoke with McDonough, she said that the companies she represents are concerned about their policyholders.
Our member companies continue to work with their customers to make sure that people have quality care.
She says a hotline set up to handle complaints had only about 100 calls and most have been resolved. Plus, she pointed to a $25 million fund that was put up by the legislature to help companies with the change in fees. Those who provide that care are concerned that more and more caregivers will be forced to go out of business. And the problem, they say, is getting worse the longer the lower reimbursements remain at their current rate. Vicki Paul Trudgeon is a case manager for Ridgemore Services and says even after finding healthcare workers for a provider to take care of one of her clients, the future is still uncertain.
They're losing $4,000 a week on that case alone. So they can't sustain that much longer. They're waiting for this bill to see if they'll be able to continue.
Representative Green's bill is not the first attempt to reform the reform of no-fault. Others have been introduced and gone nowhere. And even if this bill was to move through the process, it could take weeks or longer. And some providers say they just can't hold out that long. You can read a copy of the bill and get that hotline number for the Department of Insurance in my story at woodtv.com. Susan?